Hello, my name is Jacobs Slifka, and I'm a medical officer on the long-term care team at the Centers for Disease Control and Prevention, and a part of the infection prevention and control team with the COVID-19 response. This is a pre-recorded webinar. The goal of this webinar is to help prepare nursing homes, assisted living facilities, and other long-term care and residential facilities to prepare for COVID-19. Next slide. Given their congregate nature, frail and older adults residing in long-term care facilities are at the highest risk from COVID-19. If infected with the virus that causes COVID-19, this population is more likely to experience severe illness, require hospitalization, and is at increased risk of death. Ill visitors and healthcare personnel are the most likely and maybe the earliest sources of introduction of COVID-19 into the facility. We've also seen visitors of long-term care facilities develop COVID-19 and have seen movement of both ill healthcare personnel who may work at more than one facility and residents being associated with outbreaks. To protect our vulnerable residents, nursing homes, assisted living, and other residential care facilities should assume that COVID-19 is already in their community and take aggressive efforts to keep residents, visitors, and healthcare personnel healthy. The goal of this presentation is to describe COVID-19 and to discuss the key strategies to prepare long-term care facilities for COVID-19. Next slide. We'll start with talking about COVID-19. COVID-19 is the abbreviation for Coronavirus Disease 2019. CO stands for corona, VI stands for virus, disease, or D stands for disease, and 19 refers to the year 2019, COVID-19. COVID-19 is a respiratory illness that is caused by a virus called a coronavirus. You may hear reference to SARS-CoV-2, which is the name of the coronavirus that causes COVID-19. SARS-CoV-2 is related to SARS-CoV and MERS-CoV. The first person who was confirmed to have COVID-19 in the United States occurred on January 21st, 2020. And on January 31st, Health and Human Services Secretary Alex Azar declared a public health emergency for the United States. We are now seeing COVID-19 in communities throughout the US. The primary way the virus causing COVID-19 is transmitted is via the person-to-person route. What this means is that the virus can spread between people who are in close contact with one another. Usually that means less than about 6 feet apart. Through respiratory droplets, when a person infected with the virus coughs or sneezes. It may also be possible to get COVID-19 by touching surfaces or objects that the virus is on, such as a doorknob, a tabletop, a bathroom faucet, or even a blood pressure machine, and then touching your mouth, nose, or eyes. It is important to note that COVID-19 is a new disease, and we are still learning exactly how it spreads. COVID-19 can be spread easily in long-term care facilities, including nursing homes, assisted living, and other residential care settings, and can spread between residents, healthcare personnel, and visitors. Ill and COVID-19 infected healthcare personnel or visitors are the most likely sources of introduction of COVID-19 into the facility. It is for this reason that implementation of visitor restrictions as early as possible and ensuring that ill healthcare personnel do not work via supportive sick leave policies are recommended now. It takes between 2 to 14 days from the time a person is exposed to developing signs and symptoms of COVID-19. And for most people, this is about 4 days. The most common symptoms include fever, cough, sore throat, shortness of breath, muscle aches, and fatigue. Less common symptoms include sputum production, headache, and diarrhea. And older adults may not show typical symptoms. A fever may be absent, and initial symptoms may be mild. Older adults and people who have severe underlying chronic medical conditions like heart or lung disease, diabetes, or are immunocompromised seem to be at higher risk for developing more serious complications from COVID-19 illness. Older adults residing in nursing homes, assisted living facilities, and long-term care and residential facilities are highly vulnerable and at the highest risk from COVID-19. The clinical course of COVID-19 can vary from having no symptoms, very mild, up to severe or even fatal illness. The mortality rate increases with age, and in a report from China was almost 15% for adults greater than 80 years of age. This is similar to 1 to 2 out of every 10 people dying if they are over the age of 80. The signs and symptoms of illness may worsen with progression to lower respiratory tract disease during the second week of illness. We are still learning about the illness in older adults, but we have seen reports of older adults developing severe illness very quickly. There is not specific treatment for COVID-19 currently available, so clinical management includes prompt identification so that the appropriate infection prevention and control measures, as well as supportive care, can be rapidly initiated. I'm now going to move on to ways in which your facility can start to prepare for COVID-19. The 5 key strategies to prepare for COVID-19 that we will be discussing are: keep COVID-19 from entering your facility, identify infections early, prevent spread of COVID-19, assess supply of personal protective equipment, and initiate measures to optimize current supply, and identify and manage severe illness. If you are not already doing this, you should restrict visitors as soon as possible in order to keep your residents safe. One of the most important things that you can do to prevent the entry of COVID-19 into your nursing home or assisted living facility is to restrict visitation. Both CDC and the Centers for Medicare and Medicaid Services, CMS, have issued strong recommendations to immediately restrict all visitation to nursing homes. There may be some exceptions for certain compassionate care situations, such as end of life, but no other visitors should be allowed entrance into these facilities at this time, and absolutely no ill person should be allowed to enter the facility for the safety of the residents, visitors, and facility staff. In addition to restricting visitors, CDC is recommending that you restrict any non-essential healthcare personnel from entering the building. We recognize that this may not be an easy task, but the overall goal is to minimize potential exposure of nursing home and assisted living residents to individuals that may be able to spread COVID-19. For those of you that have not yet had COVID-19 in your facility, now is the time to think about how you might do this. The first step may be to create a list of all staff, visiting consultants, volunteers, and any other services that enter your facility. This will look different for every facility, but you may consider engaging each of those different services and providers in order to create a plan for services that absolutely must continue for the necessary medical care of your residents, those that may be delayed, or those that could be stopped, even if temporarily. All field trips outside of the facility should be canceled, and residents should avoid leaving the building for social or other events. And in some situations, residents may need to leave the facility for medical purposes, such as for hemodialysis. In these situations, residents should wear a face mask whenever they leave the room, including for procedures or medical visits outside of the facility. We recognize the negative impact that social isolation can have on this population, but are recommending such extreme measures due to the risk of severe illness and mortality among older adults. So communication at this time becomes essential in order to help residents and families understand the current situation and maintain connection with loved ones. CDC has created a template letter shown on the right side of the screen and available on our long-term care COVID-19 website, and with a link also shown below for nursing homes and assisted living facilities to share with residents and families that explains visitor restrictions, how healthcare personnel and residents will be monitored for symptoms of respiratory illness, the infection prevention and control practices that they can expect to see in the facility, such as the use of personal protective equipment or PPE, and actions that residents can take, such as how residents may practice social distancing and clean their hands. We encourage you during this rapidly changing situation to incorporate alternative methods for communication, such as phone or video conferencing, to allow residents and families to connect. Post signs at the entrances to your facility that instruct visitors not to enter, and provide contact information for those who have questions. And we recommend that you maintain contact information for family and friends of residents, as well as share the facility's preferred contact information with those individuals so that important messages can continue to be communicated. All visitation should be restricted at this time, as we want to prevent any ill individuals from entering the building. However, as I mentioned previously, there are some compassionate care situations, such as end of life, during which we encourage the facility to consider an exception to that visitation restriction on a case-by-case basis. These visitors during end-of-life situations must first be screened for fever and symptoms of respiratory infection, and if permitted entry, should frequently perform hand hygiene, wear a face mask, and should limit their movement and interaction with others to either the resident's room or another area designated by the facility. In your communication with residents and families, we encourage you to provide information about COVID-19, as well as actions the facility is taking to protect them and their loved ones. It may be helpful to explain that visitors can serve as a source of infection in the facility, which is the reason for the visitation restriction. Some residents may be able to participate, so educating them on which actions they can take to prevent or to protect themselves, such as washing their hands, covering their cough, and limiting handshakes and hugs, may be empowering. We have learned from current outbreaks that ill healthcare personnel are one of the ways that COVID-19 can enter nursing homes and assisted living facilities. So you should actively screen all healthcare personnel, including any visiting or consultant healthcare personnel, for fever and symptoms of respiratory infection at the start of their shift. Take each person's temperature. As noted at the bottom of the slide, we are considering a fever to be anything greater than or equal to 100 degrees Fahrenheit. Each staff member should be assessed for and report any symptoms of respiratory infection, including new or changed cough, shortness of breath, and sore throat. Minimal and atypical symptoms have also been reported, so please consider further evaluation for symptoms including muscle aches, nausea, vomiting, diarrhea, abdominal pain, headache, runny nose, and fatigue. If at work, ill staff should immediately stop working. They should put on a face mask, notify their facility supervisor, and go home. The well-being of your facility staff is essential to the continued care of your residents. In order to keep residents and healthcare personnel healthy, facility staff must have the ability to stay home when they are ill. Staff should regularly monitor themselves even when not working. For additional staff education, CDC has numerous resources available on the CDC webpage with an abundance of information that can be used to educate both facility-based and consultant personnel on COVID-19. Topics to cover include information on infection prevention and control measures to keep yourself safe and prevent spread of COVID-19 in the facility, hand hygiene and selection and use of PPE, which includes how to don and doff PPE, as well as strategies to conserve or optimize PPE when supplies are low. We have included links at the end of this presentation and encourage you to check them out and also to create a communication chain with your staff so that you can rapidly disseminate any messages. Identify infections early is the second key strategy to preparing long-term care facilities for COVID-19. Starting now, you should be screening all of your residents at least daily for fever and symptoms of respiratory infection. Residents should also be screened at time of admission. Screening includes obtaining the resident's temperature and assessing residents for symptoms of new or change in cough, sore throat, difficulty breathing, and feeling feverish. If able, residents should be educated and asked to report these symptoms as well. It is important to note again that older adults may not show typical symptoms. Fever may be absent, and initial symptoms may appear mild. Even without fever, less common symptoms such as a new or worsening malaise, new dizziness, and diarrhea should be evaluated. Actively monitoring or screening residents involves gathering and recording information on residents with fever or symptoms of respiratory infection that can help you determine if you have multiple residents with similar symptoms and help you to continue to monitor them while ill. CDC has a long-term care respiratory surveillance tool, which is available online, a picture of which is shown here, and can be used to help you record and evaluate residents throughout a unit or the entire facility. It is extremely important that nursing homes, assisted living, and other long-term care facilities notify the health department for residents with severe respiratory infection, or if they identify a cluster of residents and/or healthcare personnel with new onset respiratory symptoms. If you have any suspicion of COVID-19, please get in touch with the health department. Knowing your local and state health department contacts can help speed up this process. Your healthcare associated infection program point of contact can be located through this link on the slide. The importance of identifying infection early is to quickly act to prevent the spread of COVID-19. Social distancing of residents is another challenging but important strategy for preventing the spread of COVID-19. Although activities and socialization are so important for these adults, CDC is recommending that group activities are canceled and residents try to maintain a distance of at least 6 feet apart from one another. Since communal dining involves many residents and facility staff in the same place at the same time, communal dining should be halted. However, residents must continue to be safely fed, so residents may need residents' needs may dictate exactly how your facility implements dining for the immediate future. We encourage you to find creative ways to continue to keep your residents active and engaged and share those ideas with one another. Once COVID-19 is reported in your community, healthcare personnel should begin to practice universal face mask use as soon as they enter the building. This means that healthcare personnel put on a mask and keep a mask on at all times while in the building. Universal face mask use when COVID-19 is in the community is an added layer of protection or source control to prevent healthcare personnel who come and go from the facility from bringing in and spreading COVID-19. Since PPE are in short supply, they should be prioritized for healthcare personnel or frontline staff who provide direct resident care. And healthcare personnel should also be practicing social distancing from one another. If COVID-19 is identified in the facility, all residents should be restricted to their rooms, and healthcare personnel should wear all recommended PPE for all resident care, regardless of whether residents are having symptoms or not. This approach is recommended to account for residents who may be infected but are not showing any symptoms. Recent outbreaks have shown us that some residents may not have symptoms and others may have very mild symptoms. I want to remind you of the importance of notifying the public health department. When residents and healthcare personnel with suspicion for COVID-19 are identified, public health can help to inform decisions about testing additional staff or residents on the unit and in the facility. As soon as an ill resident is identified, that resident should immediately be restricted to their room. If the facility has a respiratory protection program with fit-tested staff and N95 or higher level respirators, a respirator can be used. Otherwise, healthcare personnel should use face mask, gown, gloves, and eye protection for the care of any resident with an undiagnosed respiratory infection, which includes a resident with suspect or with confirmed COVID-19. The glasses that you wear each day or contact lenses are not considered adequate eye protection, so goggles or a face shield that cover the front and sides of the face should be used. Ideally, PPE is easily accessible for healthcare personnel, and placing a trash can near the exit of the room can make it easier for healthcare personnel to discard their PPE prior to exiting the room or providing care to another resident. And since contact with surfaces may possibly be a way that SARS-CoV-2 can be spread, healthcare personnel should clean and disinfect environmental surfaces, especially high-touch surfaces and shared resident equipment, such as blood pressure machines, Hoyer lifts, and blood glucose monitors, with EPA-registered hospital-grade disinfectants. Healthcare personnel should frequently perform hand hygiene, ideally with alcohol-based hand sanitizer. However, we have heard reports that alcohol-based hand sanitizer supplies may be low. So if you have alcohol-based hand sanitizer, use it, but make sure that sinks are well stocked with soap and paper towels for hand washing. And given shortages of supplies, consider designating staff to shepherd these supplies and ensure appropriate use. Signage should be placed outside of the resident room and should clearly indicate the type of precaution and required PPE as a reminder for staff about what they need to do before entering the room. These signs shown here are an example of the information that should be included. And this picture is an example of an isolation cart with PPE, disinfectant wipes, and alcohol-based hand sanitizer found outside of the room of a resident with transmission-based precautions. It may be necessary to close units or even the entire facility to new admissions when COVID-19 is found in your building. Closing to admissions and plans for cohorting residents, as well as healthcare personnel, can be discussed with the health department, and decisions will be made depending on your facility and on the current situation. We are currently facing serious PPE shortages across the country. Assess your inventory now so that you have an idea of what PPE you currently have available. We recommend looking at your supplies and trying to estimate how many days supply you may have if you had numerous residents in the facility requiring isolation for COVID-19. Know your health department and your healthcare coalition contacts so that you're able to reach out about the availability of additional PPE as necessary. Now is not the time to be expanding your use of PPE. Now is time to talk about and educate your staff on ways that they can preserve your PPE supply. Some strategies for preserving PPE supply include prioritizing gowns only for certain situations, such as for aerosol generating procedures, if they are performed in your facility, care activities where splashes and sprays are anticipated, and high contact resident care activities. These high contact resident care activities are the same activities that we have talked about previously for enhanced barrier precautions, that are the activities at highest risk of transmitting infectious pathogens, and they include dressing, bathing or showering, transferring, providing hygiene, changing linens, assisting with toileting, device care or use of a device, and wound care. And the CDC webpage does have additional strategies for preserving PPE. Another strategy is to start extended use of eye and face protection, which, depending on your inventory, may mean that healthcare personnel use the same face mask and eye protection for their entire shift and reprocess the eye protection for continued use. In order to do this, healthcare personnel would only change their gloves and gown if one is used and perform hand hygiene in between providing care to different residents, while continuing to wear the same eye protection and face mask. In this situation, the healthcare personnel must not touch their eye protection or face mask, and they would remove the eye protection and face mask only if they became damaged or soiled, and when they're leaving the unit or at the end of their shift. Performing hand hygiene before and after removal of that PPE is essential. Frail and older adults in nursing homes, assisted living facilities, and other long-term care and residential facilities are at a high risk of serious illness. Developing a plan to identify and manage severe illness early is a key strategy to prepare for COVID-19. We recommend that you maintain a list of all ill residents so that you can perform monitoring of those ill residents, including a check of their vitals and oxygen saturation at least 3 times daily, in order to identify residents who may require a higher level of care. Should a resident require a higher level of care, the receiving facility, EMS, or the transport service and the transport service personnel and the health department should be notified. In conclusion, I want to thank you for watching this webinar and for the COVID-19 preparedness efforts that you are putting into place to protect your residents and staff. I want to stress the importance of restricting visitation to nursing homes and assisted living facilities and not allowing entrance to any ill person, including healthcare personnel. Actively monitoring residents and healthcare personnel will help identify respiratory illness as early as possible so that the appropriate infection prevention and control practices can be implemented immediately. decreasing the risk of COVID-19 spreading within the facility. Make sure that you notify the health department when you identify these residents or clusters of residents or healthcare personnel with respiratory illness. Assess your PPE supply and educate your staff on ways to preserve the supply that you have. And please closely monitor any ill residents as they have a high risk of developing serious illness and progressing to that severe illness quickly. I have included links to a variety of resources available on the CDC website for more information about COVID-19 guidance and available tools and resources. And with that, I want to thank you again.